How's it going, guys? So this is Dr. Suh at Specific Chiropractic in Manhattan. We're providing Gonstead Chiropractic, New York City, NYC. So we have a special guest flew all the way from Indonesia to come visit us. So clue is in, sir. What can we do to help you?
Just looking to get a lot of relief for pain that I've had for a few years going.
Okay, what kind of issues are you dealing with, sir?
Like neck pain, a lot of neck pain in the morning when I'm exercising, just even running, a lot of neck pain as well. Headaches in the morning as well when I wake up. Sometimes I have jaw soreness as well. Grinding at night, a whole lot of things, yeah.
Grinding at night, okay.
Yeah.
So to clue into the viewers, when we hear grinding at night, that's another term what we call Bruxism, right? So, and I don't believe we also discussed over the consultation, you mentioned about TMJ as well,
Yeah.
right?
Right.
All right, so we're gonna connect all the dots. Why are you having the neck pain, the Bruxism, grinding at night, and also that TMJ?
Yeah.
Let's go, let's take a look, see what's going on. Now, this is what I do in terms of gait analysis. So as we saw earlier, what he was doing with his right foot, and I'm gonna do an exaggerated version of it. He's swinging around like this, okay? Now, the reason why he's swinging around like that is that there's a potential problem somewhere around these sacral segments. So if one of them is jammed this way, we see this ilium, this hip over here, has no choice, but says, okay, I gotta swing around that segment. So he's going to circumvent around that. So if you take a look in there, just an earlier sequence, his right foot was circumventing a little bit around it. So now we're going to isolate which one of these 5 segments is causing that problem. In addition to, as we saw from his back, the way he was walking, now, in terms of his upper body, okay, we saw how his left side was not swinging as much as the right side over here. So that tells me, okay, we got something going on around here and here. And that all helps also see what's going on this area as well, because as we take a closer look, okay, this haunted head itself, all right, it's tilting a bit, right? So, in addition to, I'm seeing implied visualization, a lot of muscle spasms and also a lot of swelling covering on the upper part and the bottom part over here, swelling over here as well, and swelling here, and also quite a bit of swelling here and here as well. So now we're going to start isolating, see what's going on. In addition to the history where it comes to play, he was complaining about bruxism, TMJ, and neck pain. So I'm already isolating and seeing, says, okay, we got these 2 major areas over here, and we also go from the bottom ground upwards. What is going on with the foundational components that's supporting this neck? Why did it compromise to the point that this finally became the straw that finally broke the camel's back kind of situation, and all those symptoms start coming about? So let's go ahead, let's take a closer look, see what's going on over here. For these potentials already, we start mapping things together from the consultation, visualization, and the gait analysis. What's going on here, 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 and there, and here as well. Okay, so let's start over instrumentation. Let's look for any potential abnormal temperatures. So the story is this. Once a tissue gets damaged, it initiates an inflammatory process that causes the blood vessels to start dilating and increasing more circulation, and that causes increased temperature in the area. We're looking for that telltale signs. And we've got one reading over here. And what do you know? We got something down here. One way down here. One right here. This is very subtle, so we're going to start tilting the scope so we can make it a little more prominent on the instrument. We still have only one point to the right, on the lower cervical region. We have another reading right up there. Now bear in mind, because we just mark all these areas does not mean we're going to adjust every single location. No, absolutely not. These are why we call them potentials. So we're going to start isolating, see what's going on, and go after the real fellas. I'm more interested in this, okay, where is the first major subluxation that caused a whole entire domino effect that resulted in this final stroke, broke the camel's back way up there. So most likely there's gonna be some kind of problem way below. And now we're just, take a look. Tender right there, sir? Yeah. How's that feel right there?
Yeah, that's
okay, so it gets up to jam both sides. So now we're checking for IN and the X rotation, that's fine. IN and the X, just slight fixation on that side. Checking for PIAS, slight on the left, more so on the right, but still not fully compromised. And we're checking every single segment. Yeah, right there, huh? Yeah, I saw you flinched over there.
Yeah.
And see, this is one huge edema swelling over here. Okay, so tiny edema right there, but not too bad. Now we're just checking how the fixations are, every single spot. Yeah, just this fella right there. Here's one. How's this fella right here?
That's okay.
Not too bad there, huh?
Yeah, that's
It's all, everything's rigid. Now right now, okay, we're just gonna mark that 5, the 5th lumbar over here. It is fixated, but you know what? It's not fully fixated. And I'm gonna verify that after we correct that 2S. How's this fella?
okay. Not as, the bottom ones were the most tender ones.
Gotcha.
Yeah.
So now, see all this over here? It's all rigid. Okay, so there's gonna be a lot of compensations going on. And if it's not addressed over time, you know, just like rust, it starts to sit in and start to degrade and cause more damage. So these are potentials. Right. See this one over here?
Yeah.
I'm also comparing it to the X-ray as well. So you do have a potential fella that if it's not addressed, it's going to be a common future problem. I'm just going to mark that, but a very good chance after we address the foundation, I bet you this one's going to go away. See, just a partial fixation. So again, I believe that's going to go away. Now this one, we have a hard fixation over here. This one most likely is not going to go away. That's going to need to be adjusted. Same thing here. And I see that in the film, we got a side slip. We'll explain that in a minute. Now, keep in mind, what I do is very efficient. I am palpating and feeling for muscle tensions and edema at the same time while I'm static and muscle palpation at the same time over here. Also already gathered quite a bit of data during the Gait analysis and emerging all this data overlaying on top of the X-ray. So that's what I'm seeing over here on the X-ray on the image right over there. At the same time, while I'm examining and testing and accumulating all this data, I'm layering all the data upon that X-ray as a framework. So we got a potential right there.
Yeah.
Okay, and then see that huge swelling right over here? Feel that big knot?
Yeah.
Yeah. The body's protecting and stabilizing something right here at this fourth cervical.
Oh, yeah.
And you feel that fellow too, right?
Yeah.
Yeah.
It's been there for a while.
Yes, it has. And we'll explain that in much more in depth. Now, I'm also checking the very top, and the reason why we do that is because just like here, over here, this way, I'm checking the foundation, but also I'm gonna see how everything's rotating. Okay, so over time, this patient accumulates some trauma and start rotating like this way, and some other spots are rotating this way, another spot start rotating that way, so on and so forth. Over time, I wanna see how this one, the very top, it still ended up this way. So now, as we start working our way from the ground upwards, untangling everything, I want to make sure that head is finally in the neutral and center alignment. So when we take a look over here, yeah, that's what I figured. He has an anteriority on the right-hand side. So let's go to the x-ray. Now, let's piece everything together. Why you have the bruxism, the TMJ, okay, and all that stuff. Now here's the story. What causes the bruxism and TMJ? Well, we have a bone right at the very top, what we call the atlas, right? Now, what's so special about that atlas, this very first bone over here? Well, we have the brain right over here, but we also have the brainstem. The brainstem travels quite a bit, right down to this region over here. Now, when there is too much rotation in the atlas, in your case, your head turned all the way over this way. What is going to happen to the blood vessels, the brain, and your vagus nerve? Everything on the right-hand side is going to start pinching off. So that means I would not be surprised you have some little troubles with breathing on the right-hand side, stomach digestion, okay? As long as you have a little hard time digesting food, absorbing nutrients, all along the intestines on the right-hand side, your adrenal gland and your kidneys doing its job, all this, right? Everything down, all the way down the right-hand side, all from here, right in the right atlas. Now, in terms of your symptoms, well, you have the bruxism, it's TMJ. Well, let's face it, our TMJ, remember, TMJ is right here, okay? Right over here, okay? And the atlas is right over here.
Yeah.
So when the atlas itself is start rotating that way, this TMJ has no choice but to rotate and move along for the ride. And that's what we see over here. Your right side, see that? It's shifted. The whole entire jaw basically did like that.
Yeah.
And because there's so much irritation in the TMJ and onto the brainstem itself, right? Your teeth, right? And your nerves are so irritated, your teeth go nuts. It says, okay, you have no choice but to start grinding. Okay? That's what bruxism is all about. How do we deal with that? First, we gotta get this atlas over here in a much more normal alignment. In other words, instead of being way over here, we gotta bring it over here. How do we do that? Well, it starts all the way down here at the foundation. Your whole entire spine itself right now it's significantly rotated this way. And then but here's the thing. I don't think you can stay like this way and walk this way.
Yeah.
Okay, it's not feasible. So we have two gyroscopes. We have the eye riding reflex, and also with the cerebellum. These two key components is what keeps our head this direction. No matter where our body is misaligned towards, the head got to face always forward. So right now, your body rotated the bottom part over here. Yeah. And so to keep this over here, the torso got to start rotating this way. But here's the thing, it's going to keep on rotating. Now you got the other problem. Now you're looking towards the right. Yeah. So something over here is going to start rotating again. Now your head's going this way. Over here, it's going to start rotating this way, rotating that way. Finally, the head this way. So that's why we're seeing all these rotations over here. So now we have this part rotating this way, this part rotating that way, over here, rotating counter direction, this one rotating that way. And this is what that slice up what we were talking about before. There is so much rotational twist going on. In addition to, this head is trying to keep it in place. It's just too much twisting going on. Way too much. Yeah. This one, it acts like a fuse and it just trips, and it trips very hard. So to the point that this bone over here, instead of just rotating just simply merely to the right, nope, goes right and keeps on going, slide right over. So in other words, from here, now if we want to overlap just like the x-ray, then we're talking like this, okay? So, but in terms of the real dimensions, no, it starts to rotate like this way. Got it. That's what we call a side slap. Yeah, so there's just too much twisting going on. It's like your body, like you're wringing a washcloth. Got it. So whenever we see this kind of problem, that means you're twisted up pretty significantly down here and way up here. Okay. We're gonna twist here, down here. And in addition to, this is also what I do. Not only see this whole entire spine merge things into a 3-dimensional image, I'm also seeing things 4th-dimensionally. And this is what we're talking about in terms of how can we finally address your bruxism and the TMJ is here. This is what you mentioned about before. You had this this crown for a very, very long time. And this one I also see here in the X-ray as well. There's a lot of structural damage here. Now here's the thing. As we start steadily restoring your biomechanics, all right, this neck over here is going to start steadily going over here. However, this top part is still going to stay. Meaning, as we finally get up to here, this cervical, and try to correct it, it's going to move here. But this top part is like this. It's going to make this even worse over here. So as we correct this, don't be surprised. Your symptoms really start flaring up. And that's why we're going to set this very deep to finally say, okay, get it to here.
Okay.
All right. That's what the battle plan is, champ.
Okay.
Let's roll. There's that fella. Now another thing, if you notice as well, while he was walking, he's no longer circumducting his right foot as much. All right. So that tells us, no, we did a good job over there, correcting that to us over there. Okay, so we do need to address that fifth lumbar after all. Okay, the fourth is coming down. No, everything else is still rigid. See, this disappears, so that's good.
Yeah. Yep.
That did not. That's unexpected. Fifth lumbar, we need to address this. Now here's a story. This is the reason why he's experiencing a little bit difference, and this is a little curveball for us as well. We have a spina bifida occulta what's going on with that fifth lumbar. Now what we mean by is this, we're supposed to have a nice arch like this, but his body didn't form that way. So what happened was, over time as we're born, this vertebrae itself is actually multiple pieces. And these two halves are supposed to come together and merge into one piece. See all these other bones? They did that. This one, it did not. This one was normal. This one was not. It did not properly merge and create it normally towards this one. So this is an abnormal segment. And you can see over here, this part over here is trying to become part of the sacral, right? So that's why it has that little biomechanics. As in other words, we're supposed to have a, no different from like having a nice hinge or ball socket. It's supposed to be nice and smooth and gliding. It does so on the right side, but not so on the left. So no, that's what we still gotta get that fellow to move. Here's the other part. Now, as you saw to the viewers, remember before, his left side, that wasn't budging. It wasn't moving too well in relation to the right. Now, you tell me, sir, what do you see that's different?
More comfort in the back when I'm walking.
Okay.
Yeah.
What I was alluding to before, you were moving too well on the left-hand side. Now, keep this in mind. When we're children, what do as babies? We crawl, right? We're not robots when we walk. We don't walk like this.
Yeah.
No, we gotta swing with every step and gait. So if there's a problem at the pelvis and the lower lumbar region, it's not gonna allow us to have that pendulum effect with our shoulders. Now we restore the biomechanics over here. That's what we saw already. Now we restore the biomechanics here.
I see.
We didn't even correct anything there, right?
Got it.
So we're, as we mentioned before, we're steadily causing more stability in the biomechanics and restoring the biomechanical function in your rest of your spine. So now let's go ahead, let's test everything else. How's that, fella?
Yeah.
Moving, huh? Feel that difference now?
Yeah. That point there, that's still a bit like.
Understood, but this is a compensation, so then we're not going to mess with that. Your body just needs some time to get used to it, because before this was rigid.
Okay.
Remember this now?
Yeah.
Do you feel how different it is?
Yeah.
How much improvement would you say?
More 10.
Huh?
Quite a bit. It's good.
Well, define quite a bit from 0 to 10. How much improvement would you say?
Probably about like 6.
60% improvement in terms of flexibility, huh?
Yeah.
Well, hey, that's a great start.
Yeah.
So now we're checking here, see?
Yeah.
That went away. See, now, see, it's more fluid here. Hey, how do you like this fella? Remember how rigid and stuck this was?
Yeah.
See?
Much better.
Yeah, this is pretty much like kind of improved by half. But no, it still needs a helping hand. We gotta restore this fella. Let's roll. Let it go, right? There's my magic spot. Let it go.
Oh.
Great job. Okay, walk around, sir. Up and down that hallway.
I feel like I'm breathing nicer. I'm not sure if that. if that's the adjustment you made for it.
Actually, that's what we
Yeah.
did, because see this over here, the X-ray on this one?
Yeah.
Okay. See these ribs here?
Yeah.
I want symmetrical.
Yeah.
But see what happened to number 5? Why is that right rib higher versus your left side?
On this one, yeah.
Yeah.
Okay.
Okay. So what I have to do is, that's why I counted here. We knocked out 2 birds with 1 stone.
Yeah.
We realigned this vertebrae and also repositioned that vertebrae, this rib over here.
Right.
Now here's the thing though, okay? Because it's anterior on this side, I'm gonna let you know, we did temporarily made it a little more anterior. All right. So that's why we're gonna do our work to steadily restore this, to get this fella from into here to get it back to here. Let's get to work. There. Got a part. Now we're gonna fix this other part. This other component. There you go. Let's show you. Here's our piece. Okay, sir. Take the mask off. Go ahead, open the mouth and close. Tell me what's different.
It's less, how do I say it? Rigid, I think, when I'm opening it, closing it.
How much improvement would you say from 0 to 10?
Good 60, 70.
60-70% improvement, huh?
Yeah.
Ain't that something? Okay.
Yeah.
But here's the thing, keep in mind, again, because the way your atlas is right now is over here, okay? And that's interesting about it, just because it restores some of the biomechanics, but it still has gone a little bit even more this way. Now I'm gonna work on the lower parts, the 6th cervical and that 4th cervical, so we can finally bring your atlas more into central region over here.
Okay.
Let's get to work.
All right, that's all. Here's one. As I explained before, I usually don't correct these two so close together, but we have no choice because after I corrected this, now we just exacerbated this fellow over here. Now we're going to address this 4th cervical. And we're going to take more of that rotation of that interiority. Relax your shoulders, a little more. No, a little more, come on. A little more deeper in that fellow. I can get it. Next. There it is.
Okay, go ahead, open the mouth and close.
Yeah,
How do you like that?
good.
Have you noticed?
Yeah.
Check out your TMJ. Try that out.
It's quicker, yeah. I can open, yeah, I know my limits and it opens and closes very, very smoothly.
Have you noticed you're not really doing like this?
Yeah.
Because before you were like quite a bit, right? So how much improvement would you say with that TMJ in the mouth right now?
Quite a lot, about 6 to 7.
6, 7.
Yeah.
Okay. That's a great start.
Yeah.
All right, let's work on the rest. Open, close, open. Give it a try. Open the mouth, close. Tell me, what's different?
Very smooth. When I can open my mouth, I can open and close my mouth much smoother now.
How's that deviation you got going on there?
Much less.
So how much improvement would you say so far right now?
About 8, I think.
80% improvement.
Yeah. 80.
Okay, I do see a little more. We got this more component of this AI. Okay, open mouth, close. No, there's our piece. Open, close. No, open, slowly close. There it is. Open. Open. Okay, go ahead. Now try it again.
Yeah. Feels straight now. I think just now it's smooth, but it was still going a bit.
Yeah, you had a slight little AI component on that, right? We just had to finish the job there. Okay, so now you mentioned 80% improvement last time. How's it now?
It's good. Almost. Now it feels great. Yeah.
Oh, what's great?
I can open and close it, and it goes up and down straight, and I would say like there's no kind of rotation and like what's the word I'm looking for?
You feel like that jaw like swing to the side?
Yeah, and I felt like I used to have to be very careful when I opened my mouth. And now it's more smooth.
Nice. Well, other thing keep in mind, because remember, your atlas was rotated severely towards this way.
Yeah.
Therefore, everything on the right vagus nerve started being compressed and starts shutting things down and running slower than it should.
Yeah.
So keep that in mind. In the following visit, let us know how's your breathing capacity on the right lung, your stomach digestion, okay, your intestines, gas, bloating, all that stuff, all right? And also, keep it surprised. Let us know in the next visit how the Bruxism, grinding at teeth at night, is coming along.
Okay.
All right, sir?
Okay.
So, give us the latest updates. How's everything doing so far?
Okay, so far. I mean, from the last time I came here, I think the biggest thing I noticed was my sleep is more uninterrupted. I think it's because my breathing is clearer and more. I'm getting more air when I breathe. I think that's like probably the main thing that I noticed.
Excellent.
Yeah.
How is that grinding at night, the bruxism?
My wife tells me it's much less. So
How much less would she say?
She says very minimal, which is good because usually it's like throughout the entire night.
Throughout the entire night. Now it's almost none.
Yeah, very minimal.
Nice.
Yeah.
How's the TMJ?
Okay. I mean, I the past 2 days haven't had any pain. Because some days, like I do have a lot of pain, and so far the last 2 days has been okay.
Great. Have you noticed any other changes in terms of breathing? Well, actually, I'm sorry.
Yeah,
you did mention about breathing, right?
that's the biggest one.
But how about digestion? Have you noticed any difference with digestion or gas or bloating?
Not yet.
Not yet.
Not
Okay,
yet.
fair enough. Well, as we mentioned before, that's what that vagus nerve is,
Yeah.
in that regard too.
Yes.
All right, excellent. Let's go ahead. Let's take a look, see what else is going on. Let's take a look, see what we got for instrumentation over here. So right now things are looking mighty clean. Yeah, things are looking very, very well. And that's what I figured.
Yeah.
Have a reading up there.
The right side. Yeah.
There's the reading. Still have it right there. Even though the instrumentation shows no findings, I'm still double checking how everything is holding on. I'm checking the biomechanics. Okay, so this is a little bit fixated. It's gonna pump. Oh, here it goes. Just pump that up. Make it go away. See them over here. Just needs a little pump. Here it is. There it is. See right there, that fourth cervical, that's still in trouble. You can tilt your head to the left. See that? That's jammed right there. All right, there's that fella. Little more. Left shoulder. Let it go. There's that magic.
Yeah. Way better. I don't feel the weirdness in that that spot that you were putting your finger on. So much nicer. Yeah.
That's all it takes.
Yeah.
All right, champ.
Yeah.
Enjoy your sleep. I'll see you in the next visit.
Okay.